Now, if you need advice on how to treat an illness, you might soon be encouraged to speak to a pharmacist at your local surgery instead of booking an appointment with a doctor.
It's a plan being put forward by the Royal College of GPs, which says it would ease the increasing demand on doctors while improving patient safety and care.
Well, joining us now is Ravi Sharma, who is a pharmacist currently working in a local surgery. Good morning to you, Ravi.
Good morning. Hi.
Thank you very much for coming in. Ravi, what do you think of this idea then about pharmacists having more responsibility?
I think it's a great incentive. Pharmacists are extremely skilled clinicians that have great knowledge around medications. They're able to provide safe and effective use of medications and help GPs and nurses with day-to-day medicine-related issues. But also there are opportunities for prescribing pharmacists to help manage patients with long-term conditions such as diabetes, for instance.
So how does it work then in the surgery where you are? Under what circumstances would I see you as opposed to my GP?
So patients who are on several different types of medications that may want to have best effective use of them. So in my surgery particularly, I've recently seen a patient who had uncontrolled diabetes because they weren't using their medications very well, because they were suffering from significant amount of side effects. I was able to sit with that patient, have a face-to-face consultation with them, spend more time with them and sort out their medications to help improve their diabetes care. So they will still be allowed to see their GPs, but for certain areas, as well as you may see your practice nurse, you will also have the opportunity to see your practice pharmacist.
So essentially you'd have a choice over who you want to see?
Yes, of course, and we're all working together in collaboration, and we all bring different skills and knowledge and expertise to the table to help improve patient care.
How much of a burden are you lifting then? I mean, how many patients are you seeing that would otherwise see a GP?
For instance, yesterday I saw up to about 35 patients in a day, and that's around medication reviews, but also around monitoring of long-term conditions such as asthma, looking at their diabetes, looking at high blood pressure and high cholesterol as well. So it's a significant amount of time we're taking away from GPs, allowing them to spend more quality time with patients face-to-face, but also see a greater number of patients on a day-to-day basis.
Ravi, we've had quite a lot of messages about this from our viewers, and mixed, some saying, you know, this is an excellent idea, Amanda saying that, but a few people concerned about essentially pharmacists knowing enough. So a lady here, Jan, says, I'd feel very uncomfortable seeing a pharmacist. We're told to see them if it's a minor ailment, but how do we know it's a minor ailment? You know, I might think I've got a stomach ache with indigestion until I was blue, and then I might have a burst appendix. So how would you reassure those people who are concerned you don't know enough?
No. We are clinically trained individuals that go through 5 years of training, and we're trained to be clinicians, and we have the skills and knowledge to actually support GPs and nurses, particularly around patients who are taking lots of medication, who have different long-term conditions. We have those knowledges that are able to really support those patients and keep them well and keep them free from ill health. And that's the most important thing, and to prevent them from ending up in hospital or A&E as well.
What about the cost though? Because presumably if you're in a GP surgery, you're being paid by the NHS. If you're working in a chemist, you're not.
No, in this instance, this is actually funded directly from the GP practice, investing in a pharmacist on a full-time basis. Obviously, I can't speak nationally, but we must remember there is a shortage of GPs at the moment, and in some areas, some practice nurses. By working together, we're able to really deliver a high quality of care. And obviously, by including a pharmacist with their skills, you're able to increase the capacity of patients you're able to see locally.
You mentioned there about qualifications and the fact you train for 5 years.
Yes.
Do you think people just don't know enough about how much training is done? Because it's only one year less than what a doctor does.
Agreed. I fully agree with that. I think with our patients, when they first saw me, it was a bit of a surprise. But working together with patients and actually finding out what skills that a pharmacist has and how we can actually support them, it's received positive comments from my patients, and I think it's something that every GP practice should be looking at.
And in terms of, again, what people have saying about this, we have Christine saying here, you know, it's a brilliant idea, no more spending unnecessary time waiting to collect prescriptions at supermarket pharmacies. Yes. I mean, could it mean pharmacies get really busy though, if everyone's going to talk to their pharmacist now, knowing that they can offer the advice a doctor could? And will that cause problems for handing out prescriptions?
It's important to note that this is about a pharmacist working in a GP practice. Community pharmacists play an essential role in this matter about dispensing medications and providing that continuity of care. But by having a contact in the GP practice, we're able to quite rightfully increase the efficiency of that repeat prescribing process and facilitate really good communication between the primary care setting.
Yeah, Ravi, thank you very much for coming in and talking to us about this.
No, thank you.
Thank you.
Subject had me really choked up for a second there. Yeah.